so the Northern Cape seems to have COVID-19 under control, but it sounds like the Premier, that council saying nobody, no province in this country will avoid mass infections.
Yeah, well, the Northern Cape has been fairly stable at the beginning and during the lockdown level 4 and 5. So we were in the early teens. I think we were about 16 to 18. And then they opened up the provincial borders to allow for people to travel to the province or where they work. And then we started seeing the increases in cases. Of course, we're currently standing at 888, 6 deaths so far. But of concern is the hotspots. So we're talking about Noupoort in the Pixley-Kaseme district. So quite a huge number of people infected. But also, as the Premier and his cabinet said, it is basically because of the proximity to the Eastern Cape. So you have people who actually work in the Eastern Cape but stay in Noupoort, and you also have people who do their shopping in Noupoort and then move back and forth across the provincial borders, and they blame that for the increase in that area, and of course creating the hotspot area. But like they said, they are looking at ways of curbing the infection, looking at localized lockdown, trying to enforce social distancing, also going to that area to create awareness, giving out free face masks, because they've also noticed that a lot of people either cannot afford it, or people are not adhering to the wearing of face masks, the hygiene, and to social distancing.
Yeah. So it would seem like the Northern Cape is in a position to sort of grab those hotspots and contain COVID-19 while the infections are very low. But are you saying that that sort of porous border is making things very difficult?
That is what the Premier and his cabinet was saying, that because people, it's not like other provinces where there's a proper where police or the army can be able to patrol that border, but also because people it's part of their life that they have to go to work, essential workers or people who are allowed to work under lockdown level 3. So that makes it a bit difficult to allow people not to go over the border. But that's why they are saying, let's go in a local level in that district municipality or in this municipality. Let's go back to lockdown level 5. And he was saying that it is much better or much more better to do it here in the Northern Cape, because unlike Gauteng, for example, where you get Kuruleni and Pretoria, who are interconnected and who are dependent on each other, you are actually able to lock down a local municipality here within the Northern Cape and say, let's take it to level 5, put in those stringent lockdown regulations and get that infection rate under control and then relax it again.
All right, we'll see what happens with that call. Of course, the economic ramifications are there as well. Still saying a third of the population could get this even before the peak. Very quickly, is the province ready in terms of beds, equipment, etc.?
They are hoping. They currently have around 2,000 beds available. They would like that to have it at 3,000. The provincial health MEC was saying that they're not there yet in terms of ventilators, but they are busy acquiring it. The part of the provincial budget was reallocated to the health department. I think it's just over 300,000 million rand, excuse me. So part of that money will go to the buying of ventilators and other equipment needed for when they reach the peak towards the end of August or in the middle of September.
All right, thank you very much. That was the SABC's Ulrich Hendriks. Lots more to come on The Full View. Stay with us. We take a short break.